Hantavirus is suspected in the deaths of 3 people and illness of at least 6 others aboard a cruise ship in the Atlantic Ocean, the World Health Organization reported May 3. Hantaviruses are groups of viruses, microscopic organisms that infect hosts, transmitted by mice and rats. They can cause serious, sometimes fatal, illnesses in people. Hantavirus disease is considered rare, with 890 cases reported in the United States between 1993 and 2023. To date, 1 case of hantavirus infection has been laboratory confirmed, and there are 5 additional suspected cases, the organization announced on X. The outbreak was reported aboard the Dutch-flagged cruise ship MV Hondius, which was traveling from Argentina to Cape Verde, an island nation off Africa's west coast. Of the 6 suspected cases, 3 patients have died and 1 was in intensive care in South Africa, WHO said. 3 people are dead and at least 3 others are sick after a suspected outbreak of hantavirus aboard a cruise ship sailing in the Atlantic Ocean, the World Health Organization, WHO, said Sunday. The 3 dead were cruise passengers on the MV Hondius, said Oceanwide Expeditions, the company that operates the ship. The vessel is currently anchored off Praia, the capital of Cape Verde, an island nation off the west coast of Africa. Oceanwide Expeditions said in a statement Monday that 149 people remain on board the ship, including 17 Americans. They will not be allowed to disembark in Cape Verde, Health Minister Maria de Luz Lima told Radio Cabo Verde on Sunday. However, local health authorities have visited the ship and assessed 2 symptomatic crew members, requiring urgent medical care, Oceanwide said. Humans most commonly become infected through contact with rodents such as rats and mice, especially with their urine, droppings, and saliva, according to the Centers for Disease Control and Prevention, CDC. Just 1 type of hantavirus, the Andes virus, is known to be able to transmit from person to person, but it is rare. It is primarily found in Chile and Argentina, where the ship originated. Still, health authorities emphasize that the outbreak does not represent a public health threat. There is no need for panic or travel restrictions, said Hans Kluge, WHO's regional director for Europe. Here's what we know about the suspected outbreak on the ship. Where had the ship been? The MV Hondius first left Ushuaia in Argentina over a month ago. According to the marine traffic ship tracking site, the Dutch-flagged passenger cruise ship made stops in Antarctica before returning to Ushuaia for a night and leaving again on April 1st. It then stopped at the British Overseas Territory of St. Helena before anchoring Sunday off Praia, marine traffic said. Along the way, passengers visited some of the world's most remote islands, where they would have seen much wildlife, including whales, dolphins, penguins, and seabirds, according to the trip's itinerary. When it reached Praia, the vessel was not authorized to dock at the port, Cape Verde's health ministry said Monday, citing a need to protect the country's public health. It is being monitored by the health authorities, and specialist medical staff are providing the necessary care, the ministry added. What do we know about the victims? The first victim was a 70-year-old Dutchman who suddenly fell ill on the ship with a fever, headache, abdominal pain, and diarrhea, South Africa's health department told CNN. He died on board on April 11th, Oceanwide said Monday, adding that the cause of death couldn't be determined on the ship. His body was disembarked at St. Helena on April 24th to be repatriated. The man's wife, who was 69 years old and also Dutch, then collapsed at an airport in South Africa while trying to fly home to the Netherlands and died at a nearby hospital, the department said. At this time, it has not been confirmed that these 2 deaths are connected to a current medical situation on board, Oceanwide added. After the ship left St. Helena, a British national fell sick on April 27th, Oceanwide said. He is now in a critical condition at private medical facility in Johannesburg, South Africa's health department said, and is the only case confirmed to be hantavirus. On May 2nd, a German national died on board the MV Hondius, though his cause of death has not yet been established, Oceanwide said. And 2 crew members, 1 British and 1 Dutch national, are currently experiencing acute respiratory symptoms, requiring urgent care, the tour operator added. Hantavirus has not been confirmed in either case. One passenger, travel vlogger Jake Rossmarin, spoke of the fear and uncertainty percolating through the ship on Monday. What's happening right now is very real for all of us here. We're not just a story. We're not just headlines, he said in a video posted on Instagram, his voice cracking with emotion. We're people with families, with lives, with people waiting for us at home. There's a lot of uncertainty, and that's the hardest part. A medical team has begun treating those on the ship who require specific care, said de Luz Lima, Cape Verde's health minister, though no decision has been made about whether to transfer the crew members to receive medical care, the tour operator said. Dutch authorities have agreed to repatriate the symptomatic crew members, as well as the body of one deceased individual, to the Netherlands, Oceanwide Expedition said. The WHO said it is facilitating coordination between member states and the ship's operators for medical evacuation of 2 symptomatic passengers, as well as full public health risk assessment and support to the remaining passengers on board. The Dutch Foreign Ministry echoed that, saying it is working to explore the possibilities of medically evacuating a few individuals from the ship. It's not clear how long the ship and its passengers will remain off the coast of Praia. Cape Verde's health authorities are monitoring this situation very closely and will provide an update as soon as possible, the country's health director, Angela Gomez, told local outlet RDC. How did the outbreak occur? Nor is it clear how the infections occurred. The Ministry of Health of Tierra del Fuego province, where Ushuaia is located, said there has never been a reported case of hantavirus in the province. However, Hantavirus is endemic in other parts of Argentina and Chile, according to the WHO. Thank you for watching. Please like, comment, and subscribe.